Hello, this is Rupa Rao, co-founder at Healthy Life. We present health and wellness solution platform for Max India, developed and hosted on EHR.Network. For Max India solution, we have referred to the Max Bupa Pulse Report of 2018 and the IRDA guidelines on wellness and preventive benefits published on September 4th, 2020. The opportunity that we see is that Max India can position themselves as a wellness partner to their customers through a gamification program and provide holistic MCD management and also entice young customers with contemporary wellness support. The solution should use a PHR approach which will be consent driven, the platform approach to cover all Max products with uninterrupted wellness support, create network of wellness professionals and create a marketplace of wellness products. Now here in this diagram, we look at two customers A and B, each of them having their own preferred primary, secondary or tertiary care providers. Now they would visit their preferred service provider and look for their existing conditions, treatment to their existing conditions. So health information is generated at their service provider. Being Max India customers, they have access to the Max PHR application through which they would now approach the Maxwell Health and Wellness Program. Now the health information generated by their preferred healthcare provider is very crucial to manage their health condition in a holistic manner. So this information should be available to the health and wellness team at Max India. Now this can be achieved through the NDHM network, which is currently in the process of being rolled out, where consent-based exchange of information can happen. Prior to this, the Max PHR application can enable customers to upload scanned documents of their health information, which can then be shared with the Maxwell team. Both the Max PHR application and the Maxwell application will be developed and hosted on EHR.Network. Now, what are the components itself that needs to be developed for this solution? There is a user interface for the Max PHR and the Maxwell applications, and then there will be a centralized Max application server that will consume the REST interfaces that EHR.Network will provide. Now the Max application service will implement in a centralized server the application logic for each of these applications. Now coming to the features itself that could be provided by these applications is the PHR application should be used to connect with the health and wellness program, that's the Maxwell program. They should be able to book appointments, they should be able to teleconsult with Maxwell, they should be able to upload the health data, manage consent, do follow-ups, add device generated data, manage the wellness gamification program itself and manage the health insurance policy too. Coming to the health and wellness program, which we are calling as Maxwell, it should enable teleconsult or face-to-face interaction with Max customers, generate consent requests for data sharing, consent health data review with consent-driven customer health data review, then care team collaboration and follow-up, then gamification of the wellness program and redemption of any of the benefits, then manage a marketplace for wellness products, integrate with the claim system integration, claim system too. Now in both these both applications will be developed over EHR.Network. So what is the advantage here? The next slide, let's talk about that. Why build applications on EHR.Network? If you look at the infographics on this slide, you will see that healthcare applications can be broadly put into certain categories like telemedicine, clinical research, PHR, outpatient, inpatient, patient feedback, remote monitoring, and insurance. Now, when applications are built in any of these market segments, they have to address some key requirements. They have to ensure that patient consent, access control to information, and security of applications data is always addressed. Now, when the applications have to be built over an interface that is open so that the applications can become portable. The open interfaces that are currently present and advocated are FHIR and OpenEHR. Now, when the application data is being created, for it to be computable, it is recommended by all standards, including the Indian EHR standard, that they have to comply to terminology standards of SNOMED, ICD-10, SNOMED CT, ICD-10 LOINC to start with, then a drug database, both generic as well as branded drugs, and many other requirements that the EHR standards of India talk about, like what is the minimal data set that has to be maintained for demographics, information of the patient, then any decision support to support protocols, clinical protocols themselves. So in essence, for an application to be developed, it needs to use a EHR service for clinical data management, a registry service to manage demographic information of patients, professional service providers, and an auth service that will ensure that access to health information and the registries are well controlled. EHR.Network provides all the capabilities that we have just discussed. So it is a health first IT infrastructure where there is centralized data management and exchange so that the applications themselves can be evolving and be dynamic in nature. Thank you. In the demo, you will see a customer, Agastya, who has visited her preferred primary care doctor to manage her diabetes. This primary care doctor is represented by a provider called HSR Clinic, and the doctor is Dr. Meghana. So for Agastya, information regarding the diabetes condition in terms of diagnosis, prescription, and tests done, and their results are all created. Now Agastya will log into the PHR app. Here the NDHM reference PHR app has been used. This will get replaced by the Max PHR app. And then link the care context information that has been generated at HSR Clinic so that it's now ready to be shared. Now Agastya will approach the wellness doctor who's part of the Maxwell team. The interface for the wellness doctor who's part of the Maxwell team is represented by an AyushEHR application which is hosted on EHR.Network. At the Ayurvedic doctor's interface, you will see that a consent request is created which will be approved by the customer Agastya. Now the information is shared, reviewed, and the Ayurvedic doctor will now be prescribing Ayurveda-based wellness regime to manage diabetes. The demo itself now. In the demo, there is a patient Agastya whose preferred doctor is at HSR Clinic. After having visited HSR Clinic, the patient is now using the PHR app to link information generated at HSR Clinic so that it can now be shared with the Maxwell team. So this linking process is what you're seeing over here. The care contexts are being linked. The consent pin is being added. The NDHM PHR application is being used for this demo here. So you see that there's a consultation that has happened, diagnostic reports have been added, and there's a prescription too. So this is the data that has been added there by Dr. Meghana, and you can see that information on the screen. So Agastya is a diabetic patient. So a diagnostic report was added for the blood test, and there was prescription given related to diabetes, and there was a secondary diagnosis also done. Retinopathy was also diagnosed, and neuropathy was also diagnosed. Diabetes neuropathy was also diagnosed. So diabetic retinopathy, peripheral neuropathy is what I diagnosed with. So now that this has been linked by through the PHR application, the patient will now approach through an appointment process not shown currently, the Maxwell team, and the Maxwell application here is represented by this AyushEHR application, which is hosted on the EHR.Network. So here, when the patient approaches the doctor, the first thing that will be done is that they would want to see the information that has been generated by the earlier doctor. So a consent request is being generated. For the patient, who's Agastya, for a time duration. So currently the consent is created for a time duration. So it's Agastya, and the purpose of the request is care management. So then you can give a time period. This is again an NDHM compliant consent request that you see in the demo. Then so what is the information that they want to review is consultation, diagnostic reports, and prescription, and the date the day. And till what time do they want? They want it till the date 1st of January 2020. So now that request has been sent out. So here you see that it is now in the requested stage. Okay. Now this request will create a notification on the PHR application. So the patient will receive a consent approval request, and here for the demo, the provider's name has been given as BTM Clinic. So then you see that the consent request has come from BTM Clinic. These are the three kinds of health information that they are requesting and when they want it to expire. So then it gets granted. Okay, and the grant process again requires consent pin to see being added now. So now you see that the consent request has been granted, and the expiry, all that is there. So now the information can be viewed by uh, by the wellness doctor. So you see that there is a diagnostic report with glucose measurement, uh, HbA1c is there. Then there is a entire nervous system that was checked by the earlier doctor. The report on that. Then there is medication that was given. So all these details are now available to this Ayurvedic doctor. So now the Ayurvedic doctor will go into the records for that patient, that they viewed all the details, and then you see that now that they've seen it, now based on Ayurveda, they want to manage the diabetic condition of the patient. Okay? That is, yeah. So then we see that what is the medication that the Ayurvedic doctor would want to provide. So here the doctor is saying take Nisha Kata Kadi Kashayam. Okay, and the dosage for that. Okay, the directions for use after food. So that's the medication order. And then so that's got added. Now the other one that they want to prescribe is Ayaskriti Arishtam. So, so this is the four food. Okay. Then in addition, what does the Ayurvedic doctor want to recommend on the treatment plan? So that could be, yeah, they are recommended yoga focused for diabetic management. Okay, this in turn, and they're saying like 30 sessions of that. This in turn may trigger a workflow within the application where yoga specialists for diabetes will contact the patient, either ask for in-person classes or online classes, follow up with them, then therapy for diabetes. It may be consists of various kinds of Ayurvedic treatments, which again can trigger a workflow and keep the engagement with the customer going. Now, this is the order. Now, this workflow can continue. That is, the patient will again be able to pull all this information into their PHR record. And if they want to, they can even share it with their preferred doctor, saying this is the recommendation that is being given. Thank you. Thanks for your time.